Good morning, and thank you for joining us for our weekly update. I'm very pleased, as always, to be joined by Dr. Lawrence Lowe, our Medical Officer of Health, and Sam Rogers, our Director of Enforcement. This week, we're delighted to be joined by a very special guest, Dr. Isaac Bogosh, infectious disease specialist at the University Health Network and a member of Ontario's Science Table and COVID-19 Vaccine Task Force. I'm sure many of you have seen Dr. Bogosh on TV before, and I've asked him here today to talk about what he thinks needs to be done to limit the impacts of this third wave, as well as to provide some insights into the province's vaccine rollout. Before I get into our numbers, I just want to say a few words about the tragic and heartbreaking loss of Emily Villegas, the 13-year-old Brampton girl who died last week after contracting COVID-19. I want to send my deepest condolences to Emily's parents, family, friends, and the entire community. We've lost too many lives to the virus here in Peel. And Emily is now the youngest person in Ontario to die from COVID-19. The news of her death truly hits home, showing us that COVID-19 does not discriminate. We knew this already, but to see the virus claim the life of someone so young is heartbreaking. Along with our neighbours in Brampton, we mourn the loss of Emily here in Mississauga, as well as all of those who lost their lives to COVID-19. Yesterday, the province announced new legislation that, if passed, will create the Ontario COVID-19 Worker Income Protection Benefit. This will give all full-time and part-time workers in Ontario access to 3 paid sick days. I want to thank the Premier and the Cabinet for putting together this program and putting it in place. This is a positive step forward. Along with the other mayors, doctors, and Labour advocates, we've been calling for paid sick days for many months. What's encouraging about this program is that it is seamless and workers don't have to apply. Workers are automatically entitled to these 3 days and will not see a disruption in their wages when they use it. The paid leave can also be used for a number of COVID-related reasons, including going for a COVID test, awaiting the results of a test, being sick with COVID-19, going to get a vaccination or experiencing a side effect from the vaccine, or having been advised to self-isolate, or taking care of a dependent who is sick and needs to self-isolate. Employers will continue to pay workers, but will be reimbursed up to $200 per day per employee through the WSIB. I am worried, however, that there are still significant gaps in the system. We know that it can take several weeks to recover from COVID-19, so the provincial program simply does not provide enough financial support. Once workers use up their 3 provincial sick days and still need to stay home to isolate or to recover from COVID, they will have to apply for federal programs like the Canada Recovery Sickness Benefit. Federal benefits are application-based and not seamless, which means that workers at this point will see a disruption to their wages while they wait for the federal supports. And it means filling out paperwork while they're sick. That's why all along I've been advocating for at least 10 days of mandated paid sick leave in Ontario for the duration of the pandemic, which would give workers the time they need to isolate and to recover from COVID-19. The province's new program will do the minimum to cover the workers who need to get tested or to get vaccinated. I encourage all workers who don't have paid sick leave through their employer to learn more about this new program by visiting ontario.ca/COVID worker benefit. You can also find information about the Canada Recovery Sickness Benefit by visiting canada.ca/benefits. The COVID-19 situation here in Peel remains very serious. This week, Peel Region is averaging 363 cases per 100,000, and that's up from 351 cases a week ago. Mississauga is averaging 282 cases per 100,000, and that's up from 275 just a week ago. The good news is that the pace of the increase has slowed down. And while this could mean that we're reaching the peak of the third wave, we are still seeing widespread transmission in our community and reports of a new variant here in Ontario. We have to continue to listen to the advice of public health. The reality is that our hospitals are at capacity and continue to transfer patients to locations across Ontario. The province is now receiving help from the federal government and other provinces to deal with our incredibly high number of COVID hospitalizations. Just yesterday, the Minister of Health announced that some chronically ill patients will be moved out of hospitals into long-term care homes without their consent to free up space for COVID patients. This is how serious things are. In Mississauga, Trillium is dealing with 122 COVID patients, 22 patients in the ICU, and another 33 suspected cases. The situation is similar at William Osler Hospital, with 144 COVID hospitalizations, 21 patients in the ICU, and another 43 suspected cases. ICUs across Ontario might soon be in a situation where gut-wrenching decisions will have to be made about who does and who doesn't receive life-saving care. I want to thank all our frontline healthcare workers who are extremely burnt out as they continue to put themselves at great risk to treat the patients in our community. And to everyone who is battling the virus or has a loved one who is, you are in our thoughts. I want to talk a little bit more about the vaccine rollout here in the region of Peel. We have now administered over 500,000 doses of the vaccine to date. This is good news. We are on track to vaccinate 40% of our adult population by the end of April and 65% of our adult population by the end of May. We've also ramped up our efforts significantly, getting more than 100,000 doses into arms every single week at our mass vaccination centres and hospitals. Earlier in the week, we received the great news that residents 45 years of age and older in hotspot postal codes are now eligible to book appointments at our mass vaccination centres or directly at Trillium Health Partners. And the childcare workers living anywhere in Peel and who have a note from their employer are also eligible to start today by calling 1-833-944-3900. I want to thank the province for opening up eligibility to more residents in Peel, and also for beginning to deliver more of the vaccine to us. Peel, which has 10% of the population of Ontario, is now receiving 10% of the province's vaccine allocation. And in May, we are expected to receive 13% of the provincial allocation, with the vast majority of it coming in the first 2 weeks of the month. This is encouraging news. Along with the other Peel mayors, I have been fighting hard to get more vaccine into our region. However, allocation to Peel will begin to drop off in the last 2 weeks of May, making it more difficult for Dr. Lowe and our hospitals to plan how and when they're able to provide vaccines. That's why today I'm urging the province to commit to delivering a consistent supply of the vaccine to Peel region. I'm also urging the province to make all of Peel a hotspot zone, which would mean including just a few more postal codes in Mississauga and one other in Caledon. Peel is a very unique region, housing more warehouses, factories, distribution centres, food processing and packaging plants than anywhere else in the GTA. We're home to an incredibly large population of essential workers who have gone into very crowded workplaces day in and day out to provide us all with the products that we rely on and that we need to survive. They keep our economy running. Our essential workers live in every corner of this region. So by making all of Peel a hotspot, we would be able to start offering the vaccine right now to everyone 45 years of age and older. Making all of Peel a hotspot will allow us to get more people vaccinated as we move through the age cohorts and categories. The reality is that we have the capacity and the supply to do this now. I've received a lot of emails this week from frustrated residents saying that they have seen unfulfilled appointments online at both of our mass vaccination centres and at our hospitals. I want to assure you that once the vaccinations were opened up this past Tuesday to residents 45 years and older in hotspots, all of these appointments quickly evaporated. They got filled. But this brings me to a very important point. We need the province to allow Peel and in fact all public health units to be nimble and to be flexible to get the vaccine out to our residents. We need the province to give the medical officers of health the ability to assess the situation and make the call as they see fit when to lower the age cohorts based on our local realities, just like they already do in York Region. Dr. Lowe has told me that with the expected new supply in May, we should be able to move more quickly through the age categories at our mass vaccination centres and at our hospitals. But we need the province to give us the ability to adjust in real time based on what we're seeing at the ground right here in Peel. Our mass vaccination centres have the capacity to do more than 15,000 vaccines a day, and I was so pleased to see that we hit that number this week. It is really the quickest and most efficient way to get the vast majority of our population vaccinated. The science table in a report that Dr. Bogosh co-authored has recommended that hotspots like Peel should be receiving 50% of Ontario's vaccine supply. I know that the Minister of Health has signaled that this would happen very soon, and we encourage you to do so. And we thank you for it. Increased supply, coupled with the freedom to move down the age categories, will ultimately mean more vaccines in arms of essential workers and all of our residents sooner. I know this rollout has been extremely confusing, as the province has not been clear in its communication. So I want to take a quick minute to go through who is currently eligible right here in Mississauga to receive the vaccine. All Mississauga residents 60 years of age and older can be vaccinated, and those 45 years of age older who are living in a hotspot can book a vaccine at one of our mass immunization centres or with our hospital partners. All Indigenous adults, healthcare workers, and people with the highest risk health conditions can also book a vaccine at these locations. Information on eligibility on how to book can be found at peelregion.ca/COVID-19 vaccine. Residents 40 and older can receive the AstraZeneca vaccine at participating pharmacies across Peel Region. All in-school educators, as well as custodians, school bus drivers, and administrative staff who work or live in hotspot postal codes can book a vaccination regardless of your age. Educators have received information from their school boards and must book an appointment by calling 1-833-943-3900. All special ed staff who support students with complex needs and all eligible childcare workers can book a vaccination if they live or work anywhere in Peel. They can book that by calling that same number, 1-833-943-3900. A bit confusing, huh? And if you're 18 plus, you might also be invited to a pop-up clinic that is targeting the vulnerable and marginalized communities in hotspot regions. We're launching 2 tomorrow, one at the Muslim Association of Canada's Islamic Centre for Ontario and one at Brampton's Islamic Centre. Another one-day pop-up is happening today at Muslim Neighbour Nexus. I know these appointments book up quickly. In fact, 7,000 appointments booked up in 2 hours. I heard from many of you that you tried to register yourself or a loved one and weren't able to. I'm also getting the question as to why we aren't seeing the same number of pop-up clinics that Toronto has. Well, the answer is simple. We do not have the numerous hospital systems and networks like Toronto does, where resources are numerous, staff are numerous, and they can be employed to run these pop-ups. In Peel, we are following the province's direction and using pop-ups to target high-risk settings as supply allows. but let's be honest, we have one hospital network, Trillium Health Partners. These pop-ups will target largely our vulnerable residents and those who are least likely to register at one of our mass vaccination centres. Dr. Lowe and the team at Peel Public Health will continue to roll out pop-up clinics in the coming weeks. Please continue to check on the region's website for locations and registration information to see if you qualify. We have also started rolling out workplace pop-up clinics like the ones currently running at Amazon, Maple Lodge, and Maple Leaf Farms. More will be coming and running soon. But like I said, the quickest and most effective way to get our entire adult population vaccinated is through the built-in capacity we already have at our mass vaccination centres. And what will allow us to get the vaccine out quickly to all residents 18 and older is a steady supply and the ability for Peel Public Health to make the decision themselves when to lower the age categories. I'm confident that if both of these things happen, we could have our entire adult population vaccinated with at least one dose by sometime in June. Before I bring up Dr. Lowe, I just want to quickly touch on the issue of international travel. I was very relieved last week when the federal government suspended flights from India and Pakistan for 30 days. That was the right move, as we're seeing very high case counts in that region and a new variant of interest. I know a lot of residents are of Indian descent, and they are closely following the situation with great concern, and my thoughts are with all of you. I have been asked numerous times whether I think we should shut the airport down entirely. Well, I think you know that we can't do that because we need to continue bringing in cargo into our country, our fresh products, supply chain products, and also our precious vaccines. We also have to allow for people to travel for essential work and for compassionate reasons. I do, however, strongly urge the federal government to ban all non-essential travel interprovincially and in and out of the country, at least until we can get Ontario's numbers under control. In Mississauga, folks, I truly believe that we are seeing the end of this nightmare. The end is in sight. Cases appear to be slowing down. Vaccinations are ramping up. Please, for now, continue to listen to the advice of public health and limit your close in-person contact with just your immediate household. Please support our local small businesses through curbside pickup and online orders. And continue to stay healthy and stay safe. And now, I'd like to invite Dr. Lowe to the podium to provide his update. Dr. Lowe?
Thank you, Madam Mayor. Thank you to you and to Council for your continued leadership. And good morning. Mississauga's weekly incidence rate for COVID-19 currently sits at 282 cases per 100,000 with a test positivity of 14.7%. And to provide my update this morning, I'm pleased to also be able to join with us on the line my esteemed colleague, Dr. Isaac Bogach. I want to start by saying that I understand that everyone is tired of this pandemic. I recognize as well that we are all tired in different ways. I think of our residents and businesses that have sacrificed for so long to keep each other safe. I think of our first responders and our healthcare providers that have fought to save lives. My own public health staff who have fought to reduce transmission rates in the community and undertake case and contact management to keep this under control. And our vulnerable who have continued to live and work in fear of infection, and especially the families that have suffered loss, including those in Brampton that are mourning the loss of our youngest victim in our community. We are tired, but we are not beaten. And the residents of Peel and Mississauga remain strong and resilient. And while our rate of increase is slowing, we have not yet seen a flattening of the curve, and we must stay the course. Our hospitals are stretched to the limit and continue to transfer patients across Ontario with more severe disease and death being noted in individuals that are younger and younger. And so we must close, vaccinate, and exit. We must bring this third wave under control for good by sticking to the plan. The thing that raises my spirits is the vaccination part of the plan. On top of our collective efforts to stay home and keep each other safe, I am proud that with our hospital partners, we have so far delivered more than 500,000 doses in the region of Peel. Over the past few weeks, Peel has been vaccinating at one of the fastest daily per capita rates among all of the large health units in Ontario. And we have now reached a point where 70% of our population over 60 are protected with a first dose. We are also roughly halfway to 70% first doses for all Peel residents, which gets us closer yet to the coverage needed to start changing the tale of the pandemic in Peel. And this week, we have expanded our outreach program to start to get out to community centres and workplaces with a focus on reaching the hardest to reach populations that face barriers to accessing our mass vaccination system. We must continue to vaccinate quickly to reduce transmission, and while it won't get us out of the third wave, it will support our efforts to prevent any future resurgences so that we can gradually, once this is under control, reopen for good. To get there, however, we know that Peel continues to face unique challenges. We are still the hardest hit community in Ontario. We know that Peel is seeing higher case rates and percent positivities, sometimes almost double what is being seen at other hotspots designated in the province. I am grateful that the provincial government is considering a redirection of crucial vaccine supplies to hotspots such as ours. Our vaccination effort has seen success to date, and our plan can get vaccine and a first dose to over 70% of Peel residents in a matter of weeks if we are given increased and consistent supply. And I want to be very clear that a temporary diversion of vaccine, while helpful, will not solve the problems in Peel and will need to be consistent. Our challenges ultimately in Peel are felt by all of us in Ontario. And while we have been grateful for our continued collaboration with the province, we are hoping for the following commitments to be seen. Firstly, that there is an increase in proposed supply to the region of Peel, and that this increase is consistent over a longer period of time that will allow us to ensure that we reach our goals. We are also requesting that the entire region of Peel be designated as a hotspot for vaccination for operational and communication clarity. We have risk everywhere. And we're also requesting that we be given the opportunity to direct how quickly we move down each age cohort. This will allow us to make the most and optimal use of our mass vaccination system that has been so efficient and effective at getting to where we are today. We're at 100,000 doses a week. We're at 45 now, and we know that each of the cohorts down to 18 plus have approximately 100,000 people there. So if you do the math, if we move quickly, it could be just within weeks that we get to the next 500,000 doses delivered. Addressing transmission in Peel ultimately benefits the entire province of Ontario, and sticking to the game plan will help us get out of this faster. And I think getting out of this faster is something that we can all agree on. With that, I'll thank you, and I'll pass it back to Mayor Crombie.
Thank you, as always, Dr. Lowe. And now I'd like to invite Dr. Isaac Bogosh, who has worked closely with the province on the vaccine rollout, as well as providing advice as a member of the Ontario Science Table. Dr. Bogosh, the floor is yours.
Thank you so much, and thank you for the invitation to chat with everyone today. Warm regards to, of course, to Mayor Crombie and to Dr. Lowe, and I'm grateful for having the opportunity to speak. I don't have the same degree of prepared messages that they do. Mine are on a little yellow sticky note here, but I really have three key messages to convey. One is that there are early signs of improvement. It's fantastic to see. We're seeing those early signs of improvement in much of the province. That's just a reflection of the public health measures starting to take effect with the lag time that we'd expect. We are not even close to being out of the woods yet. You don't have to look too far to see how stretched our hospital system is. And while there certainly are small arrows pointing in the right direction, we have a long, long way to go. Having said that, great to see early signs of improvement. Let's keep the momentum rolling. And there's no way we should be even thinking about opening up when we're at the state that we're in right now. We just have to keep going down this pathway. We'll get there. The second point is around paid sick leave. Obviously, Peel has been disproportionately impacted by the virus and by policies to curb this virus. Peel and other hotspots are really bearing the brunt of this pandemic. I think it's extremely helpful. 3 days of paid sick leave is certainly better than 0 days of paid sick leave. And certainly that is a major step in the right direction. In a perfect world, which of course we live in, but in a perfect world, you'd have seamless access to 14 days of compensation so that people can provide for themselves and their families and stay supported throughout that time. We know if you're exposed to COVID-19, you've bought yourself 14 days of quarantine. I think 14 days would be a very reasonable number for a seamless transition to a safe environment to quarantine. Lastly, we obviously have to support communities and individuals who are disproportionately impacted by this virus. Much of Peel has been disproportionately impacted by the virus and, of course, by policies to curb transmission. We know many people in Peel don't have the luxury of working from home because they are essential workers. We have to pour vaccines into these areas, and not only just allocate vaccines into these areas, but take meaningful steps to lower any possible barrier to vaccination. So it's one thing to actually put vaccines into hotspots, but you have to go the final mile and you have to get the right needles into the right arms. What does that mean? That means addressing barriers like technology barriers, mobility barriers, language barriers, financial barriers, and on and on and on. The mobile and pop-up clinics will certainly help, but it also takes a village. It really does. And really, I hope people look at their friends, look at their neighbors, look at their family, help sign people up for vaccines, safely bring them to the mass vaccine clinics, and really enable your neighborhood to get vaccinated. I'm going to stop there, and I thank you for your time.
Dr. Bogosh, what an honor to have you today. Thank you for participating. And now we are all, each of us, ready to take the media questions.
First question is for Dr. Lowe, actually, and it comes from Courtney Heels at CP24. Go ahead, Courtney.
Good morning. Mayor Crombie, you're certainly welcome to weigh in on this as well. I wanted to ask about your comments you made about calling for the province to designate all of Peel regional hotspot for the vaccines. I'm wondering if any discussions are currently underway with the province to see this happen.
So I certainly thank you, Courtney, for the question. We're in constant dialogue and discussion with our ministry partners around all of the topics that we've highlighted. Really, the focus, as I've mentioned, is threefold. We're talking about supply, access, and consistency. So ultimately, we do need an increased and a consistently increased supply, and I'm grateful that the provincial government is considering, and I think you've heard from Dr. Bogoch as well, who sits on the science table to really try to pour vaccine into this community. We have capacity. We are willing to ramp up capacity. The access speaks to the need to really try to give us the say in terms of, as the public health unit, what we're seeing. When we're seeing bookings start to come more and more available, that's when we need to drop down quicker through the age bands. In general, we're seeing after opening an age band within 5 to 7 days, sometimes even as short as 3 days, that we're starting to have more availability. So we need to be given that opportunity to keep moving quickly. And then, of course, for consistency, just to really explain right now, it's very confusing to some degree with the postal codes, and with 85% of Peel considered a hotspot. It really, just for the sake of simplicity of messaging and saying, if you live in Brampton, Mississauga, or Caledon, you are eligible at this age, that would go a long way to continuing to ensure that our clinics continue at full capacity. But I'll let Madam Mayor weigh in if she'd like to add to that.
Yes, thank you, Dr. Lowe, and thank you for the opportunity. It's really a matter of 2 or 3 postal codes in Mississauga and 1 additional in Caledon, and that would ensure that everyone who is 45 plus will be vaccinated here in the region of Peel. And as we know, the virus transmits easily, and also we don't know where all these essential workers live, so it's very possible they live in every corner of our great city and of our region, so it's very possible that we are not capturing each and every one of them. I think it's very important that the entire region of Peel be considered a hotspot zone.
Follow-up?
Thank you. My next question has to do with the vaccination pop-up at the MAC Islamic Community Center. It begins tomorrow, and I understand people have registered, but we're hearing from some of our viewers who say they're waiting to see if they have, in fact, secured an appointment. So my question is, when will residents find out, and how is the demand for those appointments so far?
As from my understanding, there were 7,000 appointments opened up, and they were taken up in about 2 hours. So I think that for those listeners, those viewers who have not received confirmation, they may be waiting to hear if there are cancellations or any additional supply. But perhaps I'll allow Dr. Lowe to comment further on that.
Thank you. So indeed, our pop-up program in Peel is rolling out differently than in other jurisdictions. Really, with all of our community considered a hotspot, you can think of our mass vaccination sites as a really big pop-up, because ultimately everyone that is going through the 15,000 doses a day that we're capable of doing lives in a hotspot as designated by the province. And that makes our situation unique in Ontario. Our aim with the expansion of our mobile program is to get to some of the harder to reach communities, those that face significant barriers or significant challenges in getting to a mass vaccination site, even with the community ambassadors and the community networks that have been set up to push arms to needles. And so in the case of the MAC Islamic Center, because it is such a grassroots effort to get to those vulnerable groups, the community agency, in this case the Islamic Center, has really taken the lead in terms of a lot of the bookings and running, just to make sure that both the care that is provided is culturally congruent, that they are able to reach the hardest to reach members of the identified community, and that they are also able to provide broader clinics there. But I think the key message that I would say here is for individuals who are in the region of Peel, if you're someone who is within the age group and capable and able to get to a mass vaccination clinic, our encouragement is make sure that you go when you're eligible. Those are our quickest and most effective way out there. And then in terms of the pop-ups, the community agencies will continue to work with their community and with the people that have booked there to ensure that we are getting to the hardest to reach population. So to the people that are waiting, I would say stay tuned, and the community agency that is running the pop-up clinic together with us in Peel Public Health will certainly be in touch shortly. Thanks so much.
Just before we move on, if I could add that I know Dr. Lowe has a number of other pop-up clinics planned. Many community groups have come forward offering their facilities to run pop-up clinics. That said, it's still the most efficient and effective way is to register at the mass vaccination site when your age cohort is called. And I will say that I had a conversation with the Premier yesterday and let him know how important it was to Peel Region that we be designated a hotspot zone so that all people 45 plus notwithstanding can be vaccinated as soon as possible, and also ask that we have that Dr. Lowe is permitted to make that decision right at the ground level, because he and the mayors and our public health team here, we know best the circumstances on the ground and when we're ready to move down the age cohort groups so that everyone can be vaccinated in the most efficient and effective way.
Your next question comes from Vanessa Ballantyne at The Pointer. Go ahead, Vanessa.
Hi, thank you. Good morning.
Good morning.
Both of my questions are for Dr. Lowe.
Sure, no problem.
Thanks.
Go ahead, Vanessa.
Hi, Dr. Lowe. My first question is about pop-up and community vaccination. Many people are reporting that for the latest community and pop-up clinics in Peel, only those with access to the internet, who are working from home, who know English and have the time to wait for hours at a time, are able to secure those appointments, and not the essential workers who are most at risk. So moving forward, how is Peel Public Health addressing these inequities associated with the current approach to community pop-up vaccination?
Well, thanks, Vanessa. As I said in my previous remarks, we are doing a multi-channel strategy here, and we do work with community ambassadors and agencies to get people registered and push them to mass vaccination clinics. I know there's a significant focus on pop-ups right now, but you can bring arms to needles just as easily as you can bring needles to arms. So I think that's the first thing I would say in respect of that. That has been continuing since the beginning of our campaign and continues to ensure that many of those who don't have access to the internet, don't have access to mainstream bookings can actually be pushed there through our community partnerships and community agencies. In respect to these pop-ups, as I've mentioned, they are not typically intended for the general public, especially the general public that is able to get to the mass vaccination sites. They are being run together with community groups, community centers to really get to the hardest to reach and to access. And so to the extent that we are working with the community agencies to reach people who may not have internet, who may not have access, that will continue to be the focus of our pop-up clinics going forward. Do you have another question?
Follow-up?
Yeah, thank you. So just kind of getting more specifics, now that we've received word that Peel will be getting about 430,000 doses of the vaccine in May, can we get an estimation of how many doses of that will be going towards the mass vaccination sites and how many will be going towards mobile and pop-up community sites?
So again, our mass vaccination sites are continuing at approximately 100,000 a week. And those appointments are, I want to be very clear here. People think that nothing is happening. 100% of our appointments are filled at our mass clinics, and all those people live in a hotspot because our entire community is a hotspot. So we are vaccinating 100,000 residents a week that live in hotspots in Peel. So with that 430,000 doses, it will be throughout the entire system, both mass as well as mobile, to get us quickly through age cohorts. If you do the math, as I said, 100,000, you go down from 45, 40, you're now down to 30, 20, and eventually when you get to 20, you might as well drop to 18. The reality is we are not too far away, and we will deploy the vaccine where we see fit in the most effective and efficient manner to get us all out of this quickly. Thanks for the question.
Next question.
Your next question comes from Ashley Newport at Mississauga. Go ahead, Ashley.
Good morning, Mayor Crombie.
Good morning, Ashley. Thank you for joining us as always.
Thank you. I wanted to ask about outdoor restrictions. I know it's been over a week since you called on the province to ease some outdoor restrictions. Have they responded to you at all? Have there been any conversations or discussions that you know of if the province plans to over the next few weeks as the weather improves to make it a little bit easier for residents to meet safely outdoors, or have you not heard anything about that from the province?
Thank you. So let me just say that we know the science table has recommended that outdoor activity is safe and should be continued. And so we were very disappointed when initially the announcement had been made. And of course, the Premier did walk back the playground restrictions, and I'm very grateful for that. It's very hard to say no to a 2-year-old who wants to swing on a swing or slide down a slide. However, we also feel that it's important that people get fresh air, exercise. It's great for their physical and their mental health. And so we think that since the risk of transmission in outdoor activities is minuscule, they should be allowed. Now, I know that when Dr. Lowe comes up here, he's going to say he doesn't want to send mixed messages about reopenings at a time when we're at the peak of our third wave, and I understand that. But from my perspective, I think these are safe, where the risk of transmission is low. And I think I would like to see soccer and baseball and basketball and of course tennis and golf and outdoor fitness, etc. All those wonderful activities that people need for their physical and mental health. Has there been further conversations with the province? There has not. But I am very hopeful that as the peak begins to decline and we go down the other side, perhaps in a week's time, then those may be the first to be reopened. That's my hope, Ashley. I don't know if you want to hear from Dr. Lowe. I know what he's going to say. He thinks the risk is minimal as well, but he thinks it's mixed signaling at this time to open anything new.
Oh, thank you. Oh.
Unless you want to hear from him.
Oh, sure, if he wants to speak.
He does,
absolutely.
Thank you.
Yes. Oh, great, thank you.
Yes, thanks, Madam Mayor. Thanks, Ashley, for the question. So certainly, I know that in terms of measures and restrictions on outdoor amenities, those wouldn't necessarily have been my first priority in enhancing the current stay-at-home order. We do know that there is benefit to being outdoors. People, deriving mental health, fresh air, those sort of pieces. We do know also that adhering to things like distancing and masking, particularly on playgrounds, for example, amongst children where distancing is not necessarily possible, those can be helpful to also diminish the risk even further. So my understanding is that the Ontario Science Table has been looking at this, and I'm hopeful that we'll hear from them in their briefing as to their view as to where this needs to go at this time. Thanks so much.
Ashley, before you leave, I want to ask Dr. Bogosh to comment on this as well, because I know he's been very public with his comments on outdoor recreation facilities. Dr. Bogosh?
Thanks. Yeah. I mean, I boil it down into very simple terms, right? Indoor, not safe. Outdoor, safer. Not necessarily safe, but much safer, right? I mean, if you're outside, the risk of getting this infection is tiny. If you can't separate by 2 meters, put on a mask. We're in an era where nothing's 100% risk-free. I share the same sentiment that Mayor Crombie and Dr. Lowe have, that outdoor activities certainly are very, very good for physical health, for mental well-being, and it's basically the lowest of low-risk areas for COVID-19 transmission. It's not 0%, but it's the lowest of low-risk areas. I'm not making the policy, but personally, I'd be very permissive for outdoor activities and outdoor events. We don't want to have any large gatherings, but I certainly think we can do things in a manner where we encourage people to go outside. That's where we should be. That's the safest place, and do so in a safe manner. And simple messaging, like if you can't separate by 2 meters, put on a mask, and have some limits on size gatherings would be reasonable.
Ashley, did you want the perspective from our bylaw enforcement on gatherings, or?
Sure.
Sam? I always like to give everybody an opportunity to come up to the podium, especially when they're waiting here patiently. Sam, over to you for any update you want to provide as well.
Hi, Ashley, and thank you, Mayor Crombie, for the opportunity. Certainly echo the sentiments of everybody that's already spoken. What we're seeing from a bylaw perspective, and certainly what we're expecting to see, is more and more pressure and more people going outside, wanting to get some exercise, and coming up against, violating the rules. We have seen a real uptick in violations. Most of them have resulted in just straight education, voluntary compliance, and people leave the recreational amenities. So somebody playing tennis, shooting some hoops on a basketball court, and kicking around a soccer ball. None of that's permitted right now. Where we did lay a lot of charges this last weekend, though, were 2 specific incidents, which were organized games. Which have never been permitted, under any of the sort of lockdown or shutdown regulations before. Voluntary compliance was not achieved. They took great exception to it, and charges resulted out of that. But the vast majority, voluntary compliance, not aware of the rules, and we're going to see, and we are expecting to see, a large uptick with more and more people as the weather gets nicer, coming to our parks and attempting to use our recreational amenities. Thanks.
Ashley, do you have a follow-up?
I do. Okay. And my follow-up is also about something related to outdoor activity. Recently, I think it was yesterday, the day before, the City of Toronto decided that they would not allow people to consume alcoholic beverages in parks, even though a lot of people were pushing for it. And I know you touched on this briefly yesterday, General Committee.
That's right.
But is this something that, especially if everyone's supposed to receive their first vaccination by end of June, and if we do see restrictions and cases and everything start to ease by July, is this something that the city would consider doing, allowing people to enjoy, wine or beer in parks within the limits that'll be placed on public gatherings and such? Is that something that the city would consider exploring or consulting on, or is that something that you don't intend to touch, or you're not sure yet?
All of the above. So, Ashley, right now, families can gather in the park for picnics safely. I don't see that they would be interested in consuming alcoholic beverages. We feel strongly that allowing the consumption of alcoholic beverages will only encourage groups to gather and mix households. And so that's not, it's not what we want to see at this time. So, perhaps later in the summer as we can have this conversation again, but right now it is not something we're willing to entertain, as you heard from the council discussion yesterday.
Your next question comes from Steve Cornwell at the Mississauga News. Go ahead, Steve.
Welcome,
morning,
Steve.
Mayor Crombie. How are you?
Good morning. I'm so well. Hope you are.
I'm well as well. Can I ask Dr. Lowe a question, please?
Absolutely.
Go ahead, Steve. How are you?
Dr. Lowe? Good. How's it going?
Good, thanks.
Just hoping for some more details on this request to change the age cohorts locally. Could you just kind of detail some of the issues that you're having with the cohorts rules as they stand now, and perhaps some details on how you would envision if this authority was allowed, like under what kind of circumstances you would expedite the age cohort changes?
So thanks, Steve, for the question. In general, what we see when we open a new age cohort is that we get to approximately 60% coverage, usually 50 to 60% coverage, usually within the first 5 to 7 days of the cohort being opened. In general, April was interesting because at the time when we went down, then we had the addition of certain occupational groups that were identified throughout the months of April, which then sort of pushed back our effort to keep moving quickly down the age cohorts. But I think the aim would be obviously to really, we keep a close eye on our capacity. Typically our clinics are booked 100%, but once you start to see that tailing off, then that's the time that you want to start opening it up to the next age cohort. And the challenge that we have right now is twofold. Firstly, that we do, and we do work closely with our provincial partners, but ultimately they hold the keys to actually unlocking that within the provincial booking system. It's a great booking system. It's one that's incredibly efficient for our clinics in terms of our clinic operations. But the challenge of having to say, all right, here's where we are, and then making the request, and then I think on their end, everyone is certainly working their very hardest, and so just trying to fit all that. It'd be a lot easier if we just had the ability to go in and say, all right, we're seeing the next, opening up in the next 3 to 5 days, so time to drop an age cohort. That's the first part. And the second challenge is related to the designation of Peel as a hotspot, a recognition that there are some postal codes that are, there's some postal codes that aren't. It makes for some confusing messaging with our residents, and it also makes for a confusing challenge even operationally on the back end, where certain postal codes are now 60 plus and certain postal codes are 45 plus and moving down. Like, it would be a lot easier if it was just one age, Peel, and then basically just given the autonomy to move down together, to keep it simple for ourselves, our operations, our provincial partners, and our residents, so that we can all get through this a little bit more quickly. Thanks for the question.
Follow-up, Steve?
Sure. And for Mayor Crombie and Chief Rizzi, if she's available as well, I just was hoping for an update on the training of firefighters to jump in at the vaccination clinics. Is there any details on how many firefighters have gone through the program? And also, is there any indication that firefighters are kind of, I'm just curious about how the program will actually work. Like, will firefighters be pulled from their regular duties to do it? Like, how is that kind of balance happening?
Steve, this is the first time the fire chief has not been with us for one of our press conferences, unfortunately. But I do know, she's not here, but we can ask her the question over email or give her a call. But I do know that the firefighters have begun their training. I know that because I'm in regular contact with some of them, and they're pretty excited about having the ability to roll out, particularly being employed through Trillium Health Partners to assist them, or at these pop-up clinics. So they're very excited about this program, begun their training, and hopefully we'll see them administering vaccines in arms very soon.
The final question of the day comes from Pooja Luthra at Y Media. Go ahead. I'll unmute her right now. Go ahead.
Welcome, Pooja.
Hi, good morning. Thank you so much for taking my question. Okay, so my question is related to the paid sick days leave. Yes. And I would like to know, are you satisfied with the way the province is going to implement it, and what all changes would you like to recommend?
Okay, so is that for me? Because I think Dr. Bogosh gave a great explanation. If he's online, I'll let him start, and then I'll conclude as well. Dr. Bogosh, are you still?
Yeah, sure.
Yeah, I'm here. Yeah, I mean, listen, at the end of the day, I think obviously something is better than nothing, right? You have 3 days of paid sick leave. That's a lot better than 0 days of paid sick leave. And, that can really help facilitate people, for example, going out, getting a test. It can facilitate a lot of things. What would be ideal, of course, in a perfect world would be 14 days, right? If you are exposed to COVID-19, you have to quarantine for 14 days. If you're infected with COVID-19, you have to isolate for 10 days after your fever abates. I mean, that's obviously a lot longer than 3 days. Yep, the 3 days can certainly buy you some wiggle time to help navigate the federal system. Absolutely, it can. Obviously, if we want to have a seamless system and a system that is usable and workable, and I'm not going to pretend to be in finance. I'm just looking at this from a use case scenario. You need the easiest system possible where someone doesn't have to go into work, can stay home and consistently get support and put food on the table, provide for their family without having to do additional paperwork or navigate 2 systems rather than 1.
Thank you, Dr. Bogosh. And so this is a great step forward. We're very delighted the Premier and the Cabinet have provided these 3 paid sick days. But as we know, this will not help a worker that's infected with COVID because the recovery time of the COVID virus is at least 14 days and could have lingering effects after that. So after the 3 days, which could be used to wait for the results of a test or perhaps even to go get vaccinated or to begin their isolation, it buys them the time to start their research on what other federal financial supports are available. So in an ideal world, 14 days, but 3 days, we're grateful for everything we'll get. But listen, this is for our most vulnerable, the essential workers. Those are the people who are working in our factories and in our warehouses, in our food processing plants that do not have paid leave. If they are sick and staying home, they are not getting paid and they don't have money to put food on the table. And that's why we know that they're making those unfortunate choices to continue to go to work. So at least they'll be home for a minimum of 3 days, and hopefully we can get this extended or topped up so that it will go longer. But certainly 3 days is a start. We know that 1 in 4 continue to go to work while symptomatic and while sick because they needed the paycheck.
Follow-up?
Yeah, thank you so much for answering that. And my second question is, I know I could be, away out of line here, but I would like to know why Mississauga is not that much active in media. Like, if we go to the Twitter account, there are least updates regarding, vaccination, where they are starting. Is this because there are not that much mass vaccination clinics in Mississauga, or why there is not that much updation?
So we have 2 websites where we can go on my website as well, mayorcrombie.ca, the city of Mississauga.ca/coronavirus, and the region of Peel.ca/coronavirus. All the information is posted on those. We have 5 mass vaccination sites. We have the International Centre, the Paramount Centre. We have 5120 here, Ontario at Derry. We have Trillium Health Partners and UTM. So we have 5 large mass vaccination sites, as well as these additional pop-ups that are coming into our community, as well as currently 3 employer-driven mobile sites to vaccinate at Amazon, at Maple Leaf Farms, and Maple Lodge, and there will be more of those as well. So the problem here in Mississauga is we don't have our own daily media as well, right? We don't have a daily newspaper. We don't have a TV station or a radio station that people can access for quick information and have information provided to them. So we're unfortunately part of the Toronto media market, and often what's going on in Toronto, what's going on in Mississauga is wrapped up in the Toronto media, and we only hear the reports of the pop-up clinics in Scarborough or the mass vaccination site at the Metro Convention Centre. But we very much have our own 5 sites here that are operating at full capacity, vaccinating 15,000 people a day, 100,000 a week, and are operating at full capacity and doing very well. Thank you.
That concludes your questions for today. Thank you for everyone who's joined.
Thank you.